Hi everyone, welcome back to my channel. It's your girl Gabby, and today we are talking about the benefits of psychotherapy, specifically talk therapy. So, historically, therapy was frowned upon because feeling, interpreting, and communicating one's emotions was discouraged and considered inappropriate within a social context. It was often viewed as a sign of weakness, but in recent years, therapy has become more normalized and socially accepted as conversations about mental health, emotional well being, and the effects of trauma have become increasingly destigmatized. This conversation was especially prevalent during the COVID-19 pandemic, when the mental global health crisis grew rapidly, with many people experiencing isolation, grief, fear, and uncertainty, which significantly increased their stress, anxiety, and depression. According to the World Health Organization 2022, anxiety and depression globally increased by 25% during the first year of the COVID-19 pandemic. The decline in people's mental health across the nation due to the hardships of COVID-19 highlighted the need for emotional support services. Telehealth therapy became popular as it allowed people to receive online therapy sessions. Talk therapy is a type of psychotherapy that involves an individual engaging in semi-structured conversations in a confidential space with a mental health professional like a psychologist, a therapist, a counselor, to name a few. This type of therapy aims to help individuals navigate dealing with stress, anxiety, depression, grief, trauma, and life situations. The therapist is responsible for using evidence-based techniques to help clients develop healthy coping strategies and reach solutions. I believe talk therapy is an effective type of psychotherapy in improving an individual's mental health and assisting them in developing healthy coping strategies. So, some may argue that talk therapy is only effective for individuals with minor challenges, not for those with severe mental health disorders like schizophrenia, paranoid personality disorder, or obsessive compulsive disorder. They may argue that medications are a more effective solution than talk therapy for individuals with severe mental health disorders. Now, although there are instances in which medication may be a better form of treatment, a combination of medication and talk therapy can be an effective treatment for individuals with severe mental health disorders. According to the American Psychological Association, research suggests that a combination of medication and cognitive behavioral therapy, which is a type of talk therapy that follows a structured format where a mental health professional helps an individual assess their feelings, thoughts, and emotions and how they are connected and influence their behaviors. It can be an effective resource in supporting individuals diagnosed with paranoid personality disorder, obsessive compulsive disorder, anxiety, depression, and post-traumatic stress disorder, to name a few. Some may also argue that accessibility to therapy services with a mental health professional is limited. And although this argument is valid, it does not account for the advancements that have been made to improve the accessibility of talk therapy services, especially since the COVID-19 pandemic. During COVID-19, telehealth therapy services grew exponentially and became an effective alternative to in-person therapy. Rabner et al. 2025 conducted a study comparing the effectiveness of cognitive behavioral therapy conducted via telehealth versus in-person for young adults with anxiety disorders. Research findings suggested that telehealth cognitive behavioral therapy was just as effective in reducing anxiety symptoms and functional impairment as in-person cognitive behavioral therapy. This research study refutes the argument that access to talk therapy is limited, since there's an option to receive services in person and virtually. According to the American Psychological Association, the use of telehealth services by Americans for mental health support rose from 49% in 2020 to 59% in 2021. This is a resource that not only accounts for the present, but can be beneficial in the future as we continue to move towards a society that is technology-based and relies on technology to allow us to connect and engage with one another across the world. Telehealth therapy services prove the effectiveness and accessibility of mental health support. Talk therapy is a type of psychotherapy that effectively supports improving an individual's mental health and developing healthy coping strategies. It allows mental health professionals to create a safe space for them to engage in conversation with clients and develop a personalized treatment plan for each client based on their needs, which may not be possible through various types of psychotherapies. Talk therapy not only addresses an individual's symptoms, but helps them create a long-term plan to improve their overall well-being. According to an analysis conducted by Kupchers et al. 2018, psychotherapy was an effective resource for depression compared to not receiving treatment for depression through psychotherapy. Overall, I believe talk therapy is an effective tool for assisting individuals' mental health, assisting individuals in navigating mental health issues and life challenges, and developing healthy coping mechanisms. It can be effective for individuals with various mental health disorders on various severity levels. And it is accessible not only in person, but virtually as well. Talk therapy can provide individuals with a confidential and safe space to openly express their challenges to a mental health professional who can provide support and guidance to improve their overall well-being. And those strategies in which the professionals use are rooted in evidence-based strategies. In today's society, seeking support for one's mental health is becoming widely embraced. So we must continue to create different ways for people to access talk therapy services and receive support from mental health professionals. It is through talk therapy that we can see an improvement in not only people's mental health, but also their relationships with others, behaviors, ability to be motivated and productive, and a reduction in unhealthy coping mechanisms that can be detrimental to their lifestyle. It is important for us to come together and look out for the mental health of not only ourselves, but for others. As someone who has been in therapy for 5 years, I can confidently attest to the many benefits that talk therapy can provide people who may be struggling with mental health or everyday life circumstances. Therapy has allowed me to better understand my emotions. It has helped me to understand why I operate the way that I operate and why I think the way that I do. And it has helped me figure out how to rewire my thought process in a more healthy manner, as well as develop healthy coping mechanisms to deal with anxiety, stress, and seasonal depression. It has given me a space to express how I feel without worrying about being judged or having my personal information shared. And it has also allowed me to seek guidance from someone outside of my own circle. It has been a positive resource for improving my overall well-being and my mental health. So, with that being said, I thank you all for joining me in today's video about the benefits of talk therapy. I hope you learned a lot about therapy and the many, many benefits that it can provide someone. And so I look forward to seeing you all in the next video. So in the meantime, make sure to like, comment, and subscribe. I look forward to seeing you in the next video. Bye.